This presentation is brought to you by the makers of Glucojoke Cola, the drink that'll get you back in the game.
Oh, I'm feeling so shaky. Oh,
You okay?
oh, I guess I didn't get enough sleep last night. This endocrine unit's kicking my butt. Sorry.
Someone help! Is there a doctor or a nurse here? She's passed out.
No need to worry. I've got this.
Look, it's student nurse guy. He'll know what to do. What do you think is wrong with her, student nurse guy?
She's a false start student. I think she just needs some sleep.
I think this is more than a lack of sleep. It's a glucose problem.
How do you know that, student nurse guy?
I've seen this before. It looks like a standard case of hypoglycemia. And plus, we're studying that right now.
One, go.
What's hypoglycemia, student nurse guy?
Well, hypo refers to less than or not enough, and glycemia refers to the sugar that is in your blood. So hypoglycemia is low blood sugar.
What makes you so sure, student nurse guy?
Yeah, what makes you so sure?
Well, let's get her to the bench and then I'll explain it.
Okay. Come on.
You know where we are?
You okay? Go ahead and lay down.
Okay.
Okay. Hypoglycemia results from insufficient insulin, which reduces tissue uptake of glucose at the intracellular level, causing your body to go into glucogenesis and gluconeogenesis, which uses up your glucose stores and breaks down fat, creating high levels of ketones and diabetic ketoacidosis.
Well, some of the causes of hypoglycemia in non-diabetic persons would be medication-related, excessive alcohol consumption, some critical illnesses may contribute, insulin overproduction, and endocrine deficiencies, according to
This
the Mayo
was
Clinic.
brought to you by the MayoClinic.com.
Yeah.
So, she seems to have gotten suddenly weak, am I right? And has anyone noticed her being tired lately?
Yeah, sure. But hey, she's a nursing student.
Yeah, student nursing guy. They all seem to be this way, you know, kind of zombie-fied.
I'm sorry.
Wake up! Wake up! Wake up! How are you doing?
Who's this weirdo?
That's student nursing guy.
Let me ask you, have you been feeling irritable? Any changes at all lately? Are you confused?
I was a little shaky earlier, but I was fine until you showed up in my face. Nursey boy.
Well, yes, I was just trying to help you out. Okay, so have you been noticing any sort of behavioral changes or anything? Shaky, lightheaded?
She's been having headaches lately.
You've been having headaches? Okay.
What do you think we can do for her?
Quick, somebody go get Glucojote.
Gluco what?
Glucojote. It's a high energy sugar drink that I use before every test and while I am studying at night.
Oh, all good.
Okay, so I'm going to check your glucose first in your blood, okay? When was the last time you had anything to eat or drink?
Yesterday?
Okay, and you have a test today and you didn't have a good breakfast?
Here you go. Here's some Glucojolt.
Let's drink this fast. All right, so you want to stop. All right, now nursing student, I'm going to go ahead and explain a couple of things to you to help you from having this happen again.
I'm all ears.
Okay, what I want you to do first is in 30 minutes I want you to go down to the cafe and get yourself a peanut butter and jelly sandwich or something. Something that's going to be able to sustain you throughout the rest of the day.
Okay.
Alright, make sure that you get a good breakfast, that you don't miss meals, and that you have snacks with you. Little drinks, 11 jelly beans, something along those lines to kind of keep your sugar levels up so that you don't get down. And then lastly, I want you to go to the doctor and get your blood glucose checked, your AGHC1.
Now,
You mean HGA1C?
Yes, exactly. That's what I mean. That way you can get pre-screened to see if you have diabetes.
Okay.
All right. Well, you take care and study well, okay?
Okay, thanks. I'm sorry I called you student nursing boy.
That's okay, because I am Super Nurse Guy!
This presentation was brought to you by Glucojolt, the drink that gets you back in the game, and by the group members Nicholas Belanger, Maria Soto, Jeff Magnuson, Christian Roman, and Amalia Zapata. The opinions stated in this presentation are not necessarily those of the Wenatchee Valley College nursing program, its directors, faculty, or staff, although they should be.